Tired of hitting sales roadblocks in your medical device sales career, not getting your product pushed forward, and missing sale quotas? Check out these top 10 mistakes that you can learn about and avoid so that you can be successful in the medical device field. Sometimes you have to learn through experience, and sometimes it's just better to be informed so you don't have to go through the mistakes that I or my colleagues have made. By learning from these, you can unlock your full potential and succeed in the hospital sales world. Now, the medical device sales role is always changing. The healthcare landscape is dynamic. Physician preferences are always moving fast. Sometimes you only have one shot with the physician or the hospital to get your foot in the door and your product in. So let's go through these 10 mistakes and learn how we can set up for success. Mistake number 1, not being on time. You have heard the old adage that if you're on time, you're late. And if you're early, you're on time. This is really true for the medical device field. If you have surgery and it's scheduled at 7, you need to be there 6:30 and prepared. If you have a surgery later in the day, you need to call to make sure that you're aware if that time changes. This goes for appointments, for lunches, for any meetings with physicians. You need to be on time. The biggest way to upset a physician is if you're late. Mistake number 2, lying about the technical features of your product or the clinical indications. I see this happen a lot when a rep doesn't know a lot about their device. They're a little bit newer to the role or the company. It's okay not to know. It's okay to tell the doctor, hey, I need a few minutes. I'm going to call someone to get the answer. But never, ever lie or incorrectly answer the question just so it looks like you know the answer. Go find the correct answer and give the physician that information. There's a patient on the table, so they need to have the most accurate information, and they're trusting you. Build trust for yourself and all the people in the medical device roles. Mistake number 3, neglecting relationships outside of the physician. I have seen this so many times where reps only focus on the physician and they ignore all the other stakeholders in the hospital, be it the cath lab staff, the OR staff, the service line directors. Obviously the VPs and C-suite are important. And it just doesn't look good, and it rubs staff the wrong way when you have these reps come in and hover all over the physicians and not acknowledge the other team members involved in delivering care. The people outside of the physician can be great resources, great friends. They can be someone you could go golf with, but they can help you tremendously as you navigate your career. Mistake number 4, poor communication skills. This could be phone calls, text messages, emails. You need to be eloquent and you need to deliver good messaging. But more importantly, poor communication really can affect your sales process, because if you're not answering the physicians with questions to really find out their pain point, and typically I like to ask 2 or 3 good questions to really dive into what's affecting this physician to see if my product can add value. You need to communicate and listen. And then you could offer a solution of what your product or service does. So many times I see reps just dump all the information about how amazing their product is without listening. Yeah, they're communicating too much. You need to listen and have a back and forth. Mistake number 5, you're a successful rep because of your clinical team. If you take advantage of your clinical team by setting them up not for success, running them ragged and doing call for you all the time, or working outside of normal typical hours, throwing them under the bus with management, you're not going to have a team anymore. Those people are going to leave for greener pastures, be it other companies or more successful reps that take care of their team. And you know what happens. It takes 3 to 6 months to hire someone, 12 to 18 months to get them up and trained so you trust them. A good rep takes care of the whole team and builds a strong microculture within the company so those clinicals will thrive. Mistake number 6, a weak value proposition. If you don't know how your device will help the patient and the physician clinically, you're going to be in trouble. Economically, if you don't know the reimbursement story behind it and how it helps the hospital, you're going to be in trouble. If you can't answer why it helps optimization or efficiency for the hospital, for the doc, for their service line, you're going to be in trouble. You start with how your product helps patients, but really good reps expand past that and understand the whole healthcare system and how their product plugs in to help all the players. Mistake number 7, mixing relationships with your physicians. First and foremost, they're your customer and they can become your friends, but always remember that is two unique relationships. Sometimes you have a really strong relationship with a physician that's based in friendship, but don't let those lines blur. It's okay to go out to games, have a drink, to play golf, but then when you're meeting them as a customer, you have to wear your medical device sales rep hat and be professional. Mistake number 8. Good reps know how to close a quarter strong. It starts 4, 8, 12 weeks before. It's not a reactive last minute effort. Your management and VPs are going to push on you to close strong, meaning the POs come in. If you could get any cases, reps that are reactive and are scrambling and put too much pressure on physicians make mistakes. If you're asking a physician for a case because you need it because your manager called, it's not a good look. Go in there prepared, ask the physician if there's any great cases for your device and push for those and the jump balls, but never be pathetic and ask for cases for yourself and your own selfish need. If something bad happens, they're going to look at you and be extremely frustrated. Mistake number 9, overpromising. If you're telling physicians that you could deliver on clinical research or new products in a limited market release, but you're not able to, it is going to upset the physician when you can't deliver. There's appropriate ways to handle those conversations. You can connect the physicians to your colleagues managing those limited market release or the clinical research and advocate for your physician on how their program could be a great pilot or research facility, but never overpromise things that you can't deliver because it can really sour relationships. And this could be even on the service level. If you can't provide 24/7 service, don't tell the physician that. If you built your business in an unsustainable way, such as covering every single hour of that physician's clinic, but you can't do that in a year because of your growth and the expectations, you're set up not for success. Mistake number 10, lacking transparency. You might be really successful, all your accounts are taken off, and then all of a sudden you're asked to nominate one physician for a special program with your company. Maybe it's delivering a new product, maybe it's research. You need to be transparent when other competitive physicians ask why you didn't choose them. If you're trying to skirt behind them with secret dinners or meetings and they find out, they're going to be extremely upset. It's a really hard conversation. It takes a lot of emotional intelligence. But if you bite the bull in the beginning and have those hard conversations, you're going to build sustainable growth for the long term, and those physicians will respect you more. That's 10 mistakes that I've learned in this field. I hope you take a second to learn from them and apply them to your experience in your medical device career. And I wanted to give a bonus mistake, which is not being hungry to learn. If you ever lose that hunger to learn and grow, you're going to be in trouble. You need to always constantly learn about your product, but even the field you work in, for example, cardiology, always grow your cardiology knowledge, learn about the physicians, the new techniques, and always stay hungry to learn. Take it further with healthcare economics, new startups, what the innovation is. If you bring that to the table, you become a really valuable asset to hospitals and physicians and a trusted advisor. So this is Medical Device Matt. Went over quickly 10 mistakes that you can make in the medical device field. Learn from these so you don't have to experience the ramifications of making them. Take care, stay tuned, more episodes coming.